Hey guys, so it is Tuesday morning, 6:30 a.m. Today we have got the appointment at Alder Hay for Bobby, so that's on my mind, but I'm looking forward to it as well. Look forward to meeting his new consultant and just have fingers crossed that we maybe hear some more about potentially him having access to this new Hemlibra medication. Sean's asleep in the living room at the minute on the couch. Baby's in there with him, he's fast asleep as well, so just Sonny and I up this morning. I'm just going to have my pint of tea because that is how much tea I need to wake up in the morning. So I need to think of some questions really that I want to ask while I'm in there, because I think of great questions and then when I'm in there I go blank. So I've got my list. Sean, what questions have you got? Hey, Baba, are you all ready to go? You ready to go, Sean?
I'm ready to go, kid.
So all packed up in the car now on our way to Alder Hay. Say hi, Sean.
Hello.
Oh, do you know what I forgot? Those list of questions that I wrote out this morning. That is just typically me and Sean all the time. Prepare, but fail to take the preparation with us. So what I'm going to do quite quickly is those questions that I've wrote out this morning, I'm going to type up quickly on the notes on my phone, just so I can refer back to it again, just in case there's something that I don't cover that I really would like to get out of today. It is, Sean there thinks it's funny. It is quite an important meeting. Obviously, it is the first time I've met this consultant. And Sean there is obviously in a very serious mood. Bobby, you alright in the back there, Chuck? Yes, I am alright. See, Bobby's fell asleep on the way here. We just arrived. We need to go and sign in. Are you waiting for our appointment, Bobby? Look at those gorgeous smiles. Just got out of the consultant's appointment, just leaving the hospital. Had some amazing news. So it is Wednesday, the day after we met with Bobby's consultant. I didn't film much when I got home yesterday because obviously we had a lot of positive news and it was great, but it was probably a little bit overwhelming, a lot to digest, and I just felt absolutely drained. So literally come home, before I knew it, it was time to get the kids in bed. So I thought, you know what, I'll just gather my thoughts and film today. So I met with Bobby's new consultant. Oh, he's so lovely, which is always great as well. And obviously the main question I had was, is Bobby going to have access to the new Hemlibra drug that's just been launched? And before I even asked the question, he addressed it straight away. So the whole meeting was based around, how exciting it's going to be, and how this consultant in 30 years have not seen such a significant move forward in medication for severe haemophilia A. So, the passion that he was talking about this new medication with was really promising. And, some of the examples he gave from some of the trials were just amazing as well. But obviously, he was realistic with us in terms of, babies have not yet moved on to Hemlibra, so there's going to be a lot of sort of monitoring that we're going to have to do in terms of, we don't really know what the dose looks like at this moment in time. So he said that Bobby's at a really good age, because obviously Bobby's 3 coming on for 4 months, so he wouldn't really be starting any treatment until he was around 10 months old, when he started to get that little bit more active and he's roaming round. That's when he was supposed to have the operation to have his port put in, which he no longer needs to have. And I can't tell you how that was my biggest fear, is obviously putting Bobby through an operation to have the port installed to his chest. Then alongside with that, the risks of, infection into the port that can lead to sepsis. And as I said, mentioned in yesterday's video, it's not the haemophilia sometimes, okay, that is a worry, but it was all the other symptomatic things that can happen with the previous prophylaxis medication and the port into the chest. So the fact that he's, one, not going to have an operation in 6 months' time to have the port installed. Two, he's not going to have to inject. We're not going to have to inject him 4 times a week with the factor VIII. So this new Hemlibra medication, he will be having 1 injection a week, which will be just under his skin into his leg. Now, the consultant said that obviously we'll monitor how that goes, but that potentially then might go to once every 2 weeks, or sometimes in some cases it might even go to 1 every 4 weeks. I mean, already from a lifestyle perspective, it's life-changing for Bobby and us as a family as well, and any sort of carers for haemophiliacs, because obviously when you're injected into the port, you've got to really make sure that you're in a really sterile environment because of the risks going straight into the bloodstream. And whilst obviously it is still going to be important that you take care where you're going to be administering, the new medication, the Hemlibra, the worry is minimised considerably. So he's not given me a specific timescale of when Bobby will be going on to the new medication. If Bobby starts getting a lot of bruises or he starts roaming around quite early, then he said that we'll just take a common sense view on when is the best time to start. And obviously for those treatments, when we start, we will go to Alder Hey on a weekly basis and they will administer the medication, and obviously we'll follow up quite closely in terms of how he's reacting to it. Honestly, the feeling of, I got quite emotional yesterday in the car on the way home. I mean, thank God for the NHS, and this timing is unreal for Bobby, that this medication's come along at just the right time for him. And then I think the biggest emotion is relief that he's not going to have the operation. He's not going to be, his risks are minimised, basically. To summarise, his risks are minimised. I mean, by all means, it's not a cure, but from reading some of the results on the trials, it's been life-changing for a lot of people. There are some people out there that are having to have the factor alongside the Hemlibra, so I appreciate and I understand that every person is going to be different, and what medication is great for some people isn't always for others. It's really early yet to know if there's going to be any future problems with things like inhibitors. Hopefully that's not the case, but still it has saved me a whole lot of heartache with his potential operation that was sort of looming in the next sort of 5 or 6 months, and just the quality of life in terms. Also, when he's coming to an age where he's going to be administering his own medication, he's not going to have to learn to find a vein and do it intravenously, and that weighed heavy on my mind. I mean, what a huge responsibility to give a child, So to summarise, obviously it's very much the start of Bobby's journey, and whilst it's new for us, it's obviously new for the team at Alder Hey Children's Hospital and all the other consultants out there in the haematology world, because like I say, it's a new drug. It works completely different to the factor VIII. There's a shed loads of questions that are yet to be answered because it's still a new drug. So the consultant said, if Bobby was to have his tonsils out in the future or a tooth, we're still trying to understand if would he need factor alongside that before any sort of minor surgeries. Say as well, Bobby's at a really good age because he's not going to really start on this medication for another 6 months, so it's going to give them time to get their heads around the medication, the new medication, but also how's it going to be administered, how we're going to sort of monitor it. So I feel really privileged that he's going to get the opportunity to go on it, and we will work really closely with the team at Alder Hey in terms of giving feedback of of how Bobby's doing. Bobby's going to be one of the first babies to go straight onto Hemlibra and, you know, and be a pioneer for the drug, I suppose. So that is a little bit of an update on Bobby's journey so far. Obviously, a really positive day for us yesterday, a really emotional, positive day. We couldn't have asked for more, really. The outcome was exactly what I wanted it to be. And I suppose I will continue to do the vlogs, especially when he starts on the medication and any sort of bumps along the road that may come with that. I'm going to document it all here on my YouTube channel. So if you haven't already, please hit the red subscribe button. That means you will be updated with any future content that I upload, and it's completely free to subscribe as well. I would love to hear from you. So maybe you're a parent with caring for a haemophiliac child, or maybe you're a haemophiliac yourself and you've maybe, you know, been on factor A and moved over to the Hemlibra. I would love to hear from other people out there dealing with similar issues and going through similar emotions. Everything from me for today on Bobby, and I look forward to maybe catching up with some of you soon. Bye.